today the topic is pattern of lung collapse. Air bronchogram in different type of lung collapse occur as resorption collapse. It will not be seen in resorption collapse. Never seen. Passive collapse, it's usual. Adhesive collapse, it's usual. Cicatrization collapse. It's seen in fibrosis. So, pre-existing lung conditions or lung diseases such as fibrosis, pleural adhesions, the reciprocal relationship between and the compensatory signs. For example, in lower lobe collapse, the diaphragmatic elevation will be marked and the hilar depression will be diminished. So now we will see different patterns of lung collapse. As there is complete collapse, complete lung collapse, lobar collapse, and round atelectasis or round collapse. In complete lung collapse, in the absence of pneumothorax or a large pleural effusion or extensive consolidation, they cause a pacification of hemithorax. The X-ray finding of a complete collapse is displacement of mediastinum to the affected side and elevation of diaphragm. Compensatory mechanisms which occur is the hyperinflation of contralateral lung and herniation across the midline. Herniation. The retrosternal space anterior to ascending aorta and posterior to the heart or under aortic arch. In lobar collapse of individual lobe occur, and that is uncomplicated by pre-existing pulmonary or lung disease. Pre-existing pulmonary or lung or pleural disease. There will be alteration in the position of fissure seen in frontal and lateral projection. Indirect sign of collapse will not occur. In rounded atelectasis, this is an unusual form of pulmonary collapse. It may be misdiagnosed as pulmonary mass. It is always pleural based. On X-ray finding a homogeneous mass that is up to 5 cm in diameter with ill-defined edges, associated with pleural thickening, and there will be vascular shadowing as comatose. Appearance is caused by peripheral lung tissue folding into itself, it is related to asbestos exposure and secondary to exudative pleural effusion. There is no pathological significance. CT scan is the diagnostic feature for rounded atelectasis. It can differentiate from other pulmonary masses. the pattern of lung collapse. Now this is the picture showing the complete lung collapse. And in complete lung collapse, what there is a mediastinal shift. Wherever there will be a collapse, the trachea and mediastinum will shift towards that side. It will pull trachea and mediastinum toward itself. The right lung lobe is hyperinflated.